So we have some questions coming up, what to do with healthy lifestyle. So the first question is, how do you eat healthy? It's a very simple question, but it is a lengthy answer, I would say. Healthy eating, you need to eat at least two fruits every day, moderate amount of carbohydrates. So moderate your carbohydrates, eat more of protein, at least moderation of fat. So this is what we have, and we should at least make sure 30 minutes of walking. Whatever you're taking in has to be taking out. So this is what it is. So you're looking at healthy lifestyle and healthy eating. What makes you much better? So the second question coming up is, what do we do if patient with post bypass surgery? Post bypass surgery, you have a lot of things that you should take care of yourself. At least walk at least 30 minutes every day. I would suggest all my patients to have meals only 8 hours a day. That is intermittent fasting. That is what I prescribe for my patients. So they eat at least in the morning by 9:30 and afternoon by around 12:30 or 1 o'clock and evening by 5 o'clock. So they eat early dinners and a late breakfast so that they have quite a good amount of space, at least 16 hours of fasting. So this causes a lot of mechanisms or a lot of enzymes to just settle down. You calms your body off and make sure that your heart is pumping good. So this is what I would say. I would tell them to go for a checkup every once in 2 months, get your cholesterols, get your blood pressures and sugars checked, and make sure that your BMI or body weight is normal, and at least 30 minutes of exercise every day. Quit smoking. So the next question coming up is, so lipid profile test is related to HDL, triglycerides, and how do you interpret it? So triglycerides are more if you're looking at carbohydrate diets and if you have thyroid problems. And second thing is HDL is what makes the cholesterol comes out of the body. So if your HDL is good, that means your cholesterol cycle is good and your cholesterol is getting out of the body. So that is why we call HDL as a good cholesterol, because it is pushing out cholesterols or fat outside the body. LDL is light density lipoproteins along with the triglycerides are the ones which cause a lot of problems to us. So you make sure that your LDL is less than 100, triglycerides less than 150. This is what we have proven by science, that if they're less than these numbers, your chances of getting heart attacks and strokes are much less than anybody else. If they're less than 50, your chances of getting stroke or heart attacks is just 0.01%. So this is what we have been proven by science. So the next question is, both my parents are hypertensive. What prescription should I have? So hypertension, we have a lot of drugs. We have to see why they're hypertensive and what is causing hypertension. Is it just stress related, or is it related to office blood pressure monitoring, or is it something related to white coat hypertension? We have to see whether is there definite secondary hypertension or not. Or then we look at primary hypertension, then we should treat them with various medication. We should also look at aspirin to prevent strokes and even statins to prevent strokes from hyperlipidemia. So aspirin and statins can also be given along with antihypertensive drugs to at least reduce the incidence of strokes and heart attacks. So how much is sleep affecting heart diseases? That's an interesting question. So sleep affecting heart attacks is what actually we call it as the cool down phase for the cardiac cycle. So heart has both its sympathetic and parasympathetic systems of nerves which actually control the heart. So during sleep, there is quite a bit of a mixture of sympathetic activity and parasympathetic activity where people keep dreaming and there is an REM sleep in between. So there is a cycle which changes. If you have 8 hours of sleep and if you have good variation of sympathetic and parasympathetic balance during your 8 hours of sleep, your incidence of cardiac diseases is much less. and that has been very well proven again and again. So getting 8 hours sleep is really good thing, but yeah, it's getting difficult for the newer age groups to get 8 hours sleep. Hope that sleep cycle improves for every person and they get much better. So what's the next question? Is there any relationship between headache and heart attacks? Yes, in couple of them we have migraines coming out with atrial septal defects. That is a small PFO spike. We have small defects between the heart. It's a small hole in the heart. So we call them PFO, patent foramen ovale. We have migraines coming out with these people, and there is newer data that suggests that if you close off these smaller holes, you will be able to reduce strokes or prevent even sudden cardiac deaths in over a period of time. But you have some select subset of them which really benefit out of it. So what kind of exercise do you suggest for patients having blood pressure is the next question. So exercise is moderate intensity exercise, at least 4 kilometers or 5 kilometers in 20 minutes is what it is, and a little bit of aerobics to stretch yourself and make sure that you stretch all your muscles, and you at least sweat at least half a liter. That is what I would say is a good amount of exercise. Decrease salt. You have 5 grams of salt every day is your limit. Make sure that you don't exceed this limit. And even a small piece of mango has 1 gram of salt. So make sure that you precisely take what kind of or what amount of salt that you're taking every day. So you know what you're looking at. So the next question is, are telling people that are stents safe or not? Yes, they're safe. They're safe in people with acute heart attacks, which has been proven again and again that if you have an acute heart attack, what saves life is a stent. It is not medication. Along with medication is what it is. So if we have to really say that if there's something with mortality benefit, that means that less death is what with is a stent. So stents definitely saves life. It definitely saves life in acute heart attacks. So don't be skeptical or don't get away with this media hypes of stents are bad or stents are not safe. Yes, they're safe in acute heart attacks. They're definitely safe if you have multiple blocks which prevent heart attacks in due course of time. If you have 90% blocks, if you think that without a stent you can just live along, that is not true. You will have a heart attack and you will probably be gone in your sleep. So we are preventing heart attacks and we are preventing death in acute heart attacks with stents. So don't get away with skepticals or small rumors that stents are just put for the sake of putting it. No. So what are the next questions is both my parents are, my father-in-law had a bypass surgery recently. What are the precautions to be taken? Yeah, make sure that you visit your doctor every 2 months or a month and exercise at least 30 minutes every day. Sugars, blood sugars, cholesterols, your blood pressure should always be monitored once a week. Make sure that, as I told you, eat only 8 hours a day and at least 14 hours of fasting is good for post-bypass people. First, initially, they will get offended that why should I fast and all this. But once you get into the habit of doing it, that's a good diet for a post-bypass surgery. That means you lose weight, you will lose a lot of fat in your body, and you will tend to be much lighter. Body is much lighter, and your heart is also much healthier. So is yoga and meditation helps in maintaining good heart? Yes. That is what our ancestors, that is what our all Vedas have been doing. So meditation keeps your mind calm, makes your body calm, makes your heart calm. It makes whole of the system calm, and at least it gives you a lot of balance or de-stressing or detoxification of the body, which makes you much better. So what is the current status of blood cholesterol and its implication in heart disease? Yes, blood cholesterol we have so much science doing research on blood cholesterol. So if a normal person, like they're non-diabetic, non-hypertensive, they're normal persons, your cholesterols should be less than total cholesterol less than 250, and your LDL cholesterol should be less than 100. And we also showed that there are a couple of trials which have shown that if that cholesterol is much more sticky. How can you call them sticky? Is there is a blood test called HSCRP, that is high sensitive CRP protein, which will tell us whether it is sticky or not. So if it is sticky, then the incidence of heart attacks are high. So we prescribe them statins, and statins have shown that they've prevented heart attacks. Statins have shown that you will have mortality benefit in high risk patients and in patients with high cholesterols and high CRP proteins. So next question is, what are the strategies to prevent heart attacks? So we have strategies like know your numbers, that is know your blood sugar, blood cholesterol, the blood pressure, and your weight. And you should also look at moderating exercise, moderate intensity exercise, and your healthy eating habits. So finally, it boils down to all these things of healthy eating habits, quit smoking, and no alcohol. So these are good habits. So how can I overcome from heart palpitations? Yes, there are a couple of people which who complain of palpitation, that they tell us, okay, we have something beating too much, and we have a lot of issues with palpitation, that is our heart is beating too much. So look at your de-stressing yourself. What I will tell most of my patients, don't get excited, or maybe do yoga and meditation for some time. We have a lot of pranayamam which have shown that you have a lot of good hormones coming out in the body and stabilizing your heart. First, second thing is get good 8 hours of sleep, so you have a balance between your sympathetic and parasympathetic system, that cools down your brain, heart, and your body. And yes, go get an ECG done, get a consultation, so that we will know what exactly is your palpitation about. So the next question is age of 49, EF is 44, and how many minutes of walking is recommended? We recommend at least 30 minutes of moderate intensity exercise, and 30 is the minimum, and you can maximum stress to around one exercise every day. So that is what I would suggest for the maximum amount of exercise. And what is this blocks in the heart? There are two types of blocks. There is an electrical block and there is an arterial block. Electrical blocks are something doing with the current of the heart. If the current of the heart is not going appropriately, you can have a left bundle branch block, or a LBBB, or a right bundle branch block is called an RBBB, where your heart is not getting enough amount of current to actually make sure that it is activated in appropriate time. So the second kind of blocks is the arterial blocks, which is the normal things that what we get, where your blood vessels, where we have 3 blood vessels to the heart mainly. And these 3 blood vessels can get some cholesterol deposits if you have high blood pressure and high cholesterols, and you're diabetic and you're obese. So all this milieu, that is all 4 or 5 of them together, can cause a good amount of risk for getting arterial blocks. That means your heart related blocks with the arteries. So this is when you get heart attacks. Once a artery getting blocked is when you get a heart attack with a lot of pain, chest pain, and reeling sensation. Some people complain of abdominal pain. A lot of people come telling me that you have gas pain, and they just get neglected for 3 to 4 days. And finally, it turns out to be a heart attack, which has gone 2 days or 3 days. And this patient is suffering, heart is already in trouble, and heart is failing. That is when people actually come, get into troubles, get a lot of complications. So make sure that you get an ECG done if you have even gas pain or abdominal pain. At least that will tell us it is not a heart attack. That is good for you. So what kind of food should be avoided during lunar cycle in heart failure patients? That's a good question. Yeah. So lunar cycles is what actually affects your body metabolism. That is what is shown by science now. And what is the kind of foods that are to be avoided in heart failure patients is you don't take too much amount of fluids during the rest of the 16 hours. In the moon diet, you take a lot of fluids, at least 5 liters to 7 liters of fluids in the rest of the 16 to 14 to 16 hours. So in heart failure patients, we don't do much like 5 to 6 liters. We tend to do around 3 liters. So if you have 3 liters, make sure that you're reducing weight. That is when it tells you, okay, you're at the right balance. And it also depends on how much you're sweating and how much you're exercising also. So weight will determine how much amount of fluid that you need to take. And regarding food which has to be prevented is you take little amount of carbohydrate, you moderate amount of fat, and at least good amount of protein is what is needed, both for the heart and even for the body in heart failure patients. So how can we overcome silent heart attacks that occur during the night and while sleeping? A very interesting question. So how do we prevent is in heart failures or in young people we have heart attacks, or even elderly people we have heart attacks who don't get up. So these people should ideally get a blood test done or even get an ECG and a treadmill test done before. So that is when we can at least diagnose people having bad heart diseases. So after the age of 35, get your blood test done, get a health checkup done, or get a treadmill done. So that will tell us when or are you at risk of a sudden cardiac death. And there was a previous question that stents are stents safe. So stents are the ones which actually save lives or which will actually prevent sudden cardiac deaths. So we have a lot of modalities, even CT scan, cardiac CTs, or cardiac coronary angiograms, or even routine coronary angiograms are the ones which will definitely tell us, is this fellow going to have a heart attack or not? And for prevention, if you're hypertensive, if you're diabetic, take aspirin and take statins to prevent heart attacks. At least sudden cardiac deaths are prevented by 65% if you're taking aspirin and statins in most of them. So is medication necessary for hypertension? By natural, we can correct it by walking or taking garlic. So yes, we have patients who have controlled their diet and they have looked at the moon diet or intermittent fasting diet, who have reduced medications from 5 to 6 medications to 1 medication. And salt is a main culprit, at least into the Indian subcontinent, where the salt intake is high and you're almost resetting your hypertensive cycle. Yes, you can control your blood pressure, but it also depends on what is the amount of salt that you're taking. Is there any genetic predisposition for your hypertension, and how much amount of exercise you're doing, and de-stressing or detoxifying your body. We have a couple of patients who have gone traveled to various meditation places and who have been off drugs for at least so Dr. EKG is okay, is a little much better. Triglycerides are high. After Medicure, my heart is still palpitation. And is there any medication for that? So you just go get an checkup done. Get a checkup done and make sure that you get some blood tests and your EKG. If it is normal, get a treadmill test done, and echo should also be done. Yeah. So the next question is, I have a family history of heart disease and I have a healthy person. However, what are the chances of me getting a heart disease in the future? A very important question, especially for younger people, where yes, if you have definitely family history of young family history, that is less than 45 years of age, somebody in your family has heart disease, it should be your risk also. So go get your cholesterol done, your homocysteine done, your blood sugar, blood pressure, your weight, and make sure that you drink a lot of water and at least exercise 30 minutes every day. Yes, you need to get your self checked at least once in 2 years or once in 3 years. If you're just having a family history, yes, you need some checkings. So I am from Hyderabad. Can exercise reverse or prevent heart attacks? Yes, exercise definitely prevents heart attacks and definitely gives some prevention to heart diseases and strokes. And can it cure heart attacks is not true, because it cannot cure heart attacks. It can only prevent heart attacks, making sure that you don't get another one. And your heart gets a lot of collaterals if you're exercising. Make sure that you have additional blood flow once you get a heart attacks also. So can yoga reduce chances of heart attacks? Yes, yoga can reduce heart attacks because you're de-stressing yourself and detoxifying yourself with good blood pressure control, good blood sugar control, and make sure that you exercise also apart from yoga. Is it any special exercise that your heart muscle healthier like older than after a heart attack? There is the couple of Tai Chi is a Chinese kind of exercise that has been proven, and our Indian traditional exercises are pranayama has been proven to reduce some amount of damage what a heart attacks has already done, and that has been proven by science that this is what it is. And is it any cardio-friendly oil? We have a couple of oils which have proven to be beneficial. That is in the Mediterranean trials, which have shown olive oil to be of a good use, which has prevented heart diseases and prevented heart attacks and strokes. And second thing is safflower oil and sunflower oil with a blend of rice bran oil. So a lot of them have oleic and ecotopantonic acids, where essential fatty acids are more, and we have poly fatty acids, where you have good linolenic and linoleic acids, which are good for your heart. So what kind of food is preferred for heart failure patients? And slightly jogging and walking will reduce blood pressure. Yeah, I have already answered this question. How can I leave smoking? So leaving smoking is a lot of determination from yourself. That is what is needed. And we have a lot of people, live examples, who just quit smoking the day that they underwent bypass surgeries or they underwent angioplasties, because they have seen what they've gone through because of smoking. So it is a personal determination that I would say that you should be determined quite good to make sure that you're off smoking. So is there any cardio-friendly oil? Yeah, cardio-friendly oil, I have already answered that. Yeah, you need olive oil or safflower oil or sunflower oil is what is with the rice bran oil is what I would suggest. Sir, is it normal to have bradycardia? My heart is diabetic, hypertensive, cold on medications. His pulse rate is always around 52 to 55. So that is always good that if you have heart rates of lower side, it has always been proven if your heart rates is less than 70, you have much more lifespan. So that's good enough. That should be not a disease until unless it is causing some trouble to your father. If it is causing some reeling sensation, or if it is causing some chest pain, or is there any giddiness or falls, that is when you should actually look at your ECG and see if that is causing any trouble. Yes, next question, is there any role for vitamin D in heart attacks? There is some role for vitamin D in general metabolism of the body rather than just for heart attacks. We give vitamin D just to make sure that your general metabolism of the body is well taken care of, and that will definitely prevent heart attacks in due course of time. And next question is, how do we do post-angioplasty? So what do you do post-angioplasty? So make sure that you take blood pressure controls, Your diabetes has sugar under control. Make sure that you take medications, aspirin and statins, and even clopidogrel, or even other antiplatelets if the doctor prescribes, and at least for a year. So don't stop your medications, because if you stop your medications, there will be a lot of changes in your heart which causes more trouble. So if you take your medications properly for 1 year, and then we can reduce your medications, you'll be much better off in the second and third years. So you can always reduce your medications in due course after some time. So make sure that you exercise every day, take your medications, your blood pressure control, your cholesterol's under control, your sugars under control, your weight under control, and make sure that you get at least 8 hours of sleep. So is there any relationship between high blood pressure and heart attacks? Yes, there is always a relationship between high blood pressure and heart attacks, and even your salt intake and high blood pressure and heart attacks. So heart attacks can cause increased damage to your heart muscle and heart blood vessels. So make sure that you don't exceed blood pressure of more than 130/80. You measure your heart blood pressure and make sure that it is controlled less than 130/80 to get your heart healthy. What are the symptoms before heart attacks? If you have any chest pain, or if you have any giddiness or any reeling sensation, sometimes even people have just left arm pain here a little bit, and left tingling sensation in the upper abdomen, and people usually think that it is some gastritis or some abdominal problem. So if you have an abdominal problem, if you think that it is an abdominal problem, don't neglect it yourself. You just get an ECG done, make sure that it is normal. That will tell you, okay, you're not having a heart attack. So what are high triglycerides, and is there any special treatment for high triglycerides? Yes, statins would be the first drug of choice for high blood cholesterols, especially triglyceride. We can also look at fenofibrates and other drugs to reduce your triglycerides. Isolated triglycerides can always be controlled with diet, and usually if it is non-hereditary. Hereditary triglyceridemia needs definitely treatment and IV injections, and we have good IV injections coming out for hypertriglyceridemia now. So we have advances in treating hypertriglyceridemia now. So what are emergency medicines to be given in heart attacks? We need to have aspirin as a loading dose, and clopidogrel and statins, to which prevents definitely a second heart attack in the immediate phase, or which will prevent deaths during acute heart attacks. So aspirin, clopidogrel, and statins are the ones which have proven to be beneficial in acute heart attacks. And after that, we will just go to the hospital. Then you have thrombolytics or even primary angioplasty, which will prevent deaths from acute heart attacks. So make sure that you have some at least nearby medications, so that if you're at risk, at least they will save your lives. So make sure that you're proximity to this. Is there any correlation between heart attacks and headaches? We've already answered it up. And if patients have high blood pressure, if they're continue to smoke and drink alcohol, sudden quitting of smoking or drinking alcohol, will it cause any changes? A lot of people have this pre-notion of if you quit alcohol or smoking, you're going to have a lot of changes and all this. So what is it if you continue or lessen or keep moderating it? It's not going to cause you anything. So it's only one thing, either you quit it or not. So you want to have the benefits of it, you just quit it. And you should quit it across. It's not like you quit it for 6 months and again restarted after 6 months. That's not the one that you're looking at. If you really want good results, you quit smoking for 2 years to 3 years, you will definitely, your risk factors of getting a heart attack comes down to normally as the other person. But whatever damage has already happened. So at least you quit your smoking and you quit your alcohol now, not to have much more damage to be caused to you. So you should always quit it with good amount of determination. So what are the warning signs of heart attacks? As I told you, you can have a vague, uncomfortable feeling, fatigue, or upper abdominal pain, or chest pain, just left arm pain, and headaches. Uh, you name it. People just present varying symptoms, but the predominant symptom is chest pain with left arm pain and upper abdominal pain. So, what are the ones with what are the risk factors, highest risk factors? Highest risk factors are diabetics and high blood pressure, high cholesterol, smoking, and an elderly person who is obese. These are highly risk factors with sedentary lifestyle. So these are the highest risk factors. So make sure that you're on aspirin, statins, and at least modify your risk factors, get all of them under control so that your risk of heart attacks are much less, risk of strokes are much less, risk of deaths are much less. So prevent heart attacks with aspirin and statins and good healthy eating lifestyles. As I told you, healthy eating lifestyles is intermittent fastings and moon diets. That's another session that we will do about it. But yeah, this is what you're supposed to do. Uh, Heart tests so that a person is called heart safe. The final ultimate test is coronary angiogram, which will tell you that your heart is safe or not. That is an ultimate test. Or we can look at nuclear scan where you can predict whether you will have any heart disease or not, in the sense if you're having any heart muscle at risk. But your ultimate test would be a coronary angiogram, whether it's a CT coronary angiogram or a conventional coronary angiogram, which will tell you whether you have heart disease, or in the sense you have any blocks in your heart arteries or not. If you have them, you are at risk. It depends on your percentage of blocks, which varies your risk. If you're having a 20% block, your heart attack risk is 0.01%. And it also depends on the cap of the small little block. If you have a thin cap and if the 20% block just blows up, you're going to have a clot there and you're going to have a heart attack. So how bad is your that 20% block is also makes the difference of whether you're going to get a heart attack with a 20% block or are you going to get it with a 90% block. As common sense says, your 90% block will cause more problems, will cause more heart attacks. And your 20% block can also cause. So the final test would be a coronary angiogram, either it a CT scan or a conventional coronary angiogram, which will tell you what is the risk of getting a heart attack. Yeah. So we have answered these questions. If there is any more questions, we would be happy. How can we? Uh, how can one stop right heart failing? So you should also look at what are the causes of right heart failure. We have varied causes of right heart failure. The first one would be smoking related, that is carpal where your lungs have high pressures and the pressure is actually transmitted to your right heart. The second cause is pulmonary thromboembolism, where we have a lot of clots coming out in your blood vessels to your lungs. So these have to be treated, and then we can say right heart failure can come down. We have newer drugs which are coming out for right heart failure with various problems like pulmonary arterial hypertensions and even shunt lesions causing some issues with right heart failure. Yeah, how much sleep is affecting your body? We have already told you that, yeah, sleep is a major factor in affecting your body of detoxification and increased uh, incidence of heart attacks. These are silent heart attacks. So you try getting at least 8 hours of sleep, a solid sleep, where your sympathetic and parasympathetic actions on your heart are stabilized, and you have much better healthy lifestyle. So, how can I control cholesterols without using medications? Yes, you can control cholesterols without using medication. Is your diet? That is what we have been talking about: a healthy diet, healthy lifestyles. So, don't eat too much of oily stuff, too much of fat, moderate amount of fat and moderate amount of carbohydrate. Eat more of protein, which gives you a lot of energy also. So your cholesterols can be controlled if you're eating almonds, you're eating fruits, and you're drinking a lot of water and exercise every day, so that your HDL improves, your LDL comes down, and your cholesterols are well controlled. Yes, you can do it, but it all depends on what kind of healthy lifestyle that you are going to do.